Hello everyone, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today.
This paper is titled Screening for Asymptomatic Carotid Artery Stenosis, U.S. Preventive Services Task Force Recommendation, published in February 2, 2021 in JAMA. Carotid artery stenosis is atherosclerotic disease that affects the extracranial carotid arteries. Asymptomatic carotid artery stenosis refers to stenosis in persons without history of ischemic stroke, TIA, or other neurological symptoms. The prevalence of asymptomatic carotid artery stenosis is generally low in the general population, but it increases with age. Asymptomatic carotid artery stenosis is a risk factor for stroke and a marker for increased risk for myocardial infarction. It causes a relatively small proportion of strokes. In 2014, the USPSTF reviewed the evidence for screening for carotid artery stenosis and issued a D recommendation. The USPSTF has decided to use a reaffirmation deliberation process to update this recommendation. This recommendation applies to adults without a history of TIA, stroke, or other neurologic signs or symptoms related to the carotid arteries. Several factors increase the risk for carotid artery stenosis, which include older age, male sex, hypertension, smoking, hypercholesterolemia, diabetes, or heart disease. There are no externally validated, reliable methods to determine who is at increased risk for carotid artery stenosis or who is at increased risk of a stroke when carotid artery stenosis is present. Several modalities, including carotid duplex ultrasonography, MRI, or CT angiography, are proposed for screening for carotid artery stenosis. Auscultation for carotid bruit has been found to have poor accuracy for detecting carotid stenosis or a stroke and is not considered a reasonable screening approach. The treatment of asymptomatic carotid artery stenosis is directed at systemic atherosclerotic disease and often includes statins, antiplatelet drugs, and management of hypertension, diabetes, lifestyle modification interventions. Carotid endarterectomy, carotid artery angioplasty with stenting, or trans-artery revascularization are the surgical options. Medical therapy can be used alone or with revascularization procedures. For patients with asymptomatic disease, the harms of surgical interventions compared with medical therapy appear to outweigh the benefits. To reaffirm in the recommendation, the USPSTF commissioned a reaffirmation evidence to review the update of 2014 review. The reaffirmation update focused on the targeted key questions on the potential benefits and harms of screening and interventions, including revascularization procedures designed to improve carotid artery blood flow in persons with no symptoms of carotid artery stenosis. The sensitivity and specificity of duplex carotid ultrasound for detecting 70% or greater stenosis were 90% and 94% respectively when compared to the reference standard of digital subtraction angiography. For auscultating the neck for carotid bruits, the 2014 evidence review found a wide range in sensitivity that ranged from 46% to 77% and specificity that ranged from 71% to 98% for detecting carotid artery stenosis. The USPSTF found no externally validated risk stratification tools that could reliably distinguish between asymptomatic persons who have clinically important carotid artery stenosis and persons who do not. The USPSTF found no studies that directly examined the health benefits of screening with duplex carotid ultrasound. It also did not find any studies that directly examines the harms of screening using duplex ultrasound. More research will be needed to evaluate the benefits and harms of screening for asymptomatic carotid stenosis in the general adult population. Now, this is the recommendation from USPSTF that has not changed or did not find any new evidence to change the recommendations from 2014. Now, there are some differences in other guidelines in the US. The US guidelines differ regarding the role of duplex ultrasound screening in patients without history of TIA, stroke, or other neurologic signs and symptoms related to the carotid artery stenosis. The AHA and American Stroke Association jointly recommend against routine screening for carotid artery stenosis in asymptomatic patients using DUS. Joint guidelines from multiple US professional societies conclude that DUS screening is indicated or may be reasonable for asymptomatic patients with carotid bruit. The Society for Vascular Surgery and joint guidelines from multiple US professional societies recommend consideration of duplex ultrasound screening in patients with multiple risk factors for a stroke or in those with known peripheral arterial disease or other cardiovascular disease.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.